arthroscopy is a minimally invasive procedure used by orthopedic surgeons to treat a variety of conditions without making a large incision. It can be used as both a diagnostic modality or also as a primary treatment modality. The hip joint is expanded and the surgeon inserts small instruments containing a lighting system to illuminate the structures inside the joint and a miniature camera, so the surgeon can visualize and examine the inside of the hip as well as repair various problems or injuries. There are some common reasons that hip arthroscopy is done. Labral tears can occur from acute injury or chronically as a result of structural abnormality. The labrum is a layer of cartilage that lines the hip socket and acts like an O-ring seal for the femoral head within the acetabulum. Femoroacetabular impingement, or FAI, is a condition where bone overgrowth occurs during the developmental years and the resulting bone spurs cause painful rubbing when moving the hip through normal ranges of motion. Dysplasia occurs when the hip joint does not form normally and the hip socket is too shallow for the ball of the femur. This results in hip microinstability and partial dislocation, which can cause pain and early fatigue of musculature around the hip. Removal of loose bodies, inflamed synovial tissue, or loose cartilage fragments causing pain. Irrigation and debridement of the hip joint for infection. The benefits of hip arthroscopy over traditional open surgeries include shorter recovery time, lower risk of complications, and delaying the advancement of arthritis by treating causal factors in their early stages. It can even delay or eliminate the need for hip replacement in some cases. Hip arthroscopy is not the only answer for patients with hip pain, but it is an excellent procedure for the right indication. In general, patients can expect to return to their activity within 3 to 6 months after a hip arthroscopy.